one great thing that he had done to make me feel more comfortable, I don't know if this was something he does with all his patients or if he had sensed that I might have been gay, but when he was asking me questions about my life in general, drug use, whatever the general questions they ask someone as a new patient, he asked if I was sexually active. I said yes, and he asked if I was sexually active with men or women, and that's when I specified men. And that was great because he provided an option. He didn't assume. There are many times you might assume someone's gay and they're not, and there's many times where you might assume that they're straight and they're not. And ultimately, it's no one's business. As a healthcare provider, you just have to focus on the facts. And I would say eliminating assumptions is probably key. And avoiding judgment is also important. And keeping things open-ended so someone can provide as much as they like or as little as they like. Although I commend all of my previous healthcare providers for being there and a lot of them were very thorough, made sure I get all my testing done, and I was always on top of my health, so I thank all of them for the past. One thing that that I touched upon in the past earlier is that making assumptions has always been kind of controversial in that I feel that immediately after I tell someone I'm gay, it's, have you been tested for HIV? Have you been tested for gonorrhea? Have you received this shot? And I don't know if that's standard, but I would say that there are ways to get your concerns out as a professional without jumping towards that path of gay equals sexually active equals promiscuous equals STD. So I feel like we can kind of navigate through that more. And ultimately, I want my doctor to ask those questions. I want someone who's holding my hand through the process. But I've seen that as a trend among physicians. It's, oh, you're gay? Do you know have you been tested for HIV? And yeah. And then also, I think for those doctors who are working with a patient who has any of those symptoms, being a comforting voice. You know, it's, as a physician, you're not a social worker. Many are not therapists, but at times where someone might have something life-risking in their blood, that's when you really have to be more than a doctor and their friend at the moment. So provide them with as many resources as you can and try to be as empathetic as possible.